Welcome to our latest episode in Leadership and Culture in Healthcare podcast. I'm Matthew Wynn, and I am delighted that I have with me today Andrea Sutcliffe. Andrea is the Chief Honcho, the lead for the Nursing and Midwifery Council. Andrea, introduce yourselves, tell people what you do, how you've got there, and maybe then tell us a little bit for those that don't know, what is the Nursing and Midwifery Council and what is it important maybe as well?
Okay, thank you very much, Matthew, and it's lovely to be with you. So I sometimes talk about getting to this job, that everything else that I've ever done in health and social care ends up in this role. So I've worked at a local level, managing services, both in acute hospitals, but also in the community. I've worked at a national level, setting standards, regulating. I've been a chief executive, which frankly, from a governance point of view, you would want to know what you were doing there, and have worked with government in various different ways and at a national level and across the 4 countries of the UK in different guises. Most recently, before I came to the Nursing Midwifery Council, I was the Chief Inspector of Adult Social Care at the Care Quality Commission, so regulating providers. And now at the Nursing and Midwifery Council, and I've been here for about 5.5 years now, we are the professional regulator for nurses and midwives across the whole of the UK and nursing associates in England. And the reason why we're important is, first and foremost, we are the biggest health and social care regulator in the UK. There are 808,488 people on our register as of the end of September 2023. And I've learnt that number off by heart because I love all the 8s in it. But what I think it brings home to you is what a huge bit of the health and social care workforce nursing and midwifery is. And 1 in 100 people in the country is on our register, which is a phenomenal statistic to think about, really. So we're important because of that, but we're also important because of what we're here to do. And we're here to fundamentally protect the public by promoting the highest professional standards for nurses, midwives, and nursing associates so that they can deliver safe, kind, and effective nursing and midwifery care. And that's it, really, in a nutshell, as to what we're here to do. I guess people can hear that and they'd still wonder, well, how on earth do you do that? And when I first came into post in 2019, spent my first year, really lucky to be able to do this, developing our strategy so that we could articulate much more clearly what it was that we were here to do. And we ended up with 3 fundamental pillars. The first is we're here to regulate. It's the cornerstone of everything that we do. And that regulation starts with setting standards. So setting standards in terms of the code of conduct for all of the professionals on our register, setting the proficiencies for each of our professions, setting the education standards, both at undergraduate and for those areas that we set postgraduate standards in postgraduate education as well. We then quality assure those education programs. So we approve programs and then we monitor in a variety of different ways to ensure that those programs are delivering people who are ready to join the register or be accredited with the postgraduate qualifications that we have. And that's a very important part of making sure that the integrity of the register is maintained. And we also maintain the integrity of the register through the work that we do in taking internationally educated nursing and midwives onto the register through assessing their competencies and health and character and all of those important things, including English language, to get onto the register. So then fundamentally, we have a register, we maintain that register, We support the professionals on the register to revalidate every 3 years, making sure that they are practicing, that they're doing the continuing professional development that they need to do, that they're reflecting on their practice and thinking about how they can do better, what they've learned, both from good feedback, but also from things that might not have gone quite so well for them. We also, like any professional regulator, have an arm of what we do, which is fitness to practice. So if specific concerns are raised about the professionals on our register, we have a duty to investigate those and to make a determination as to whether the professionals are fit to continue practicing. And this isn't about punishment. It's not about kind of going, something went wrong and we're going to jump up and down on people's heads. It is much more about saying, what happened? Is this a situation that means that this individual cannot be fit to practice for the future? And so it is forward-looking in that sense. So that's the regulatory arm of it. But what we also set out to do in the strategy was to be clear that we wanted to do that in a supportive way. And that takes a couple of different dimensions. One, support for those people who are involved in our processes. So in particular, people, be they the professionals under scrutiny, witnesses, members of the public who may well have made referrals into fitness practice. It's an incredibly stressful time for anybody that's involved in it. So how do we support them? How do we make sure that we're explaining what we do, that they know how to interact with us, all of those important things. So there's the support in that way. A support in helping people to shape what we do. So we have now a public voice forum, which helps us to do that from the public perspective. But we also have professional groups, the professional strategic advisory group and our midwifery panel, where we've got professionals helping us to work our way through what we do. But we also want to provide support in being proactive around not waiting for something to go wrong, but trying to make resources available so that professionals know what it is that they should be doing to do it right. And that's something that we do in terms of providing all sorts of resources, be they webinars, guidance documents, that kind of thing on the website. Then if we regulate well, if we do it in a supportive fashion, we sit on a goldmine of evidence. And one of the things that we heard when we did the strategy in 2019-20 was people wanted us to use that evidence for a much better effect. And they wanted us to use it to influence the safe and inclusive environments that enable people to provide safe, kind and effective care, but also to help shape workforce policy. And so we have been developing the opportunities that we have through our registration data, through looking at the issues that raised in fitness to practice, through the work that we do with our partners to influence those debates where we can and where we should. We're not a trade union. We're not a membership body, we're a regulator. We have to be clear about what our boundaries are and all of that. But there are things that we can do and that we can highlight, and that's what we try to do.
Really fascinating, Andrea, because when you have broken down that world into those kind of 3 areas, regulation, quality assurance, international recruits, and then all the other things you said about insight and data, some of that, especially the regulation, standards, code of conduct, education, quality assurance programs of education, are really setting the ingredients for people to be able to be on the register, to be fabulous at their job. And so what proportion of the time of the organisation in headcount or in time is spent on that bit compared to the fitness to practice and the revalidation aspects? So how does that kind of pan out?
So it pans out in a way that we wouldn't want, because actually what you'd want to be able to say What I'd love to be able to say is we do lots and lots of activity in the setting of the standards and the developing of the resources to support people to implement those standards, and there's lots of focus on that. We've got some fabulous teams in our professional practice directorate that do a lot of that work, and we do actually do a lot of that work in collaboration and co-production with others who are working out in the field. So we draw people in, and we're doing some work at the moment, for example, on practice learning. So we've got an independent steering group with people from across the 4 nations, an independent chair chairing that. So there is a decent amount of people and resource going into that. But sadly, because of the numbers and because of the complexity of the process that we've got to go through, which is very much hidebound by rules and regulation and precedent, all of those things, the biggest bit of the organisation is focused in terms of resources and people on fitness to practice. That is a fact of life. And we have had to increase that more recently because we have seen over the last few years our caseload increase. That particularly happened in the first year of COVID, where some of the decisions that we made to support health and social care and the way that they were managing that situation meant that we did not do as much work in that first year as we would have done normally. And so the caseload increased at that stage. And then as we've been trying to work to bring both the caseload down and to improve our timeliness, we've also in more recent times seen an increase in referrals. And so we have not been keeping pace with it. And we know that we've got to do better there. We've got to do a great deal better there. And so we have just agreed with our council a new fitness to practice improvement plan with a £30 million investment additional tag to it to try and once and for all get this cracked, because I think probably every chief executive of the NMC has said this, that they want to get to a position where you're on top of the fitness to practice caseload, you're dealing with it in a timely way, in an effective and an efficient way, which isn't dragging things out for people and is making the safe decisions that we need to make, but making them as swiftly as we can. We are not there yet. When we get there, then I hope that we'd be able to rebalance that picture enormously.
Yeah. And within that approach, you started to talk about, I used the word insight, I think you used data and understand the evidence of what you have got in terms of feedback from people. Just give us a bit more of a flavour about how you would use that, because I guess the heart of that question is if you can see trends in a provider or in maybe a group of providers, say in nursing homes, for instance, there are big groups in that, you can see things that are emerging from referrals into you and trends in there. How does the NMC use that information, and also with colleagues in government across the regulatory world, to say we need to do maybe something different here?
In a variety of different ways. So we produce every 6 months our registration data reports, and once a year we do a leavers survey of people who have left the register and produce that information. And increasingly what we're trying to do is to do that in a really accessible way so that people can look at that information and get the key signals out of it. So a critical bit of that, say for example, is the increasing numbers of people on the register who have come to us from overseas, which is now 20% of the register. And in terms of recent years, it's been a 50-50 joining from domestic recruitment and international recruitment onto the register. And I think that that's important stuff for us to share back out with the system, because actually they need to do something about that. It's been a deliberate policy to recruit internationally, but we need to be making sure that people are understanding the changing demography of the register, what that means in terms of providing proper support, encouraging and enabling people to continue on their career progression, because it is such a fundamental part of the register. The other bit that we have seen from a demographic point of view is increasing diversity of the register. So there are roughly just over 30% now of people from what you might term the global majority are on the register. And again, I think that we know that we live in a society that is discriminatory and is racist towards people, and that happens in health and social care as well. And if that is happening in health and social care to people who are working on our register, that's a patient safety issue, and it needs to be tackled, and it can't be ignored because it's nearly a third of the workforce. So again, we can bring that. The point that you made about different employers, one of the things that we have looked at, for example, is a little bit like the General Medical Council, who see this with doctors. We see disproportionate referrals of people from the global majority into fitness to practice. Why is that happening? One of the things, so we've been looking at that and trying to represent that data back out to people. But one of the things that we've seen is that there is an issue, particularly for agency staff. And there's two things here. One, disproportionately people from Black and other minority ethnic backgrounds work in agencies. And we see that if something goes wrong, an agency is much more likely to refer somebody to the NMC to deal with it, because they're much less likely to have the infrastructure to actually go through that process of reflection, insight, strengthening of practice, supporting the individual to actually be fit to practice. And so if you put those two things together, then there is an impact. And so the way that the workforce is structured also has an impact in terms of people's experience of work, but also of their relationship with their regulator. I could go on about this for hours, Matthew, so I will stop because there are lots of different examples. And last year we produced our very first insight report, which we called Spotlight on Nursing and Midwifery Education and Practice, and to rival the state of care from the Care Quality Commission and the state of medical education and practice. And we want to build on that and do that on an annual basis, and using the insight that we have from the different aspects that we can look at our data.
A few things come out there for me, Andrea. So you said about overzealous, or maybe, dare I say, lazy organisations referring people to the NMC that aren't actually doing the work themselves. And I know my own chief nurse in our organisation really struggles and really tussles with every single person that could potentially come in your direction with that mindset of, actually, isn't this our job, first of all, before we go anywhere near a regulatory framework? And the threshold, I think, is really quite high to do that. What happens with an organisation that you think continuously just perhaps, and I'm not putting words in your mouth, but perhaps passes on their responsibilities to tussle with that management and standards of people, and then say, over to you, NMC? Because it's not really your job, is it?
No, it's not. But I think that we do also have to understand the difficult circumstances that people are working in. And sometimes small and medium-sized enterprises like agencies or care homes, nursing homes, won't necessarily have the infrastructure that you and your chief nurse have got in terms of a large NHS trust. So there is something about not necessarily being pejorative in the way that I talk about them. So I'm not going to let you put those precise words in my mouth. But what I think is important for us is to feed back. to actually provide advice back to people who are referring. And one of the things that this actually started before I joined the NMC, but we've been developing and growing it over the last few years, is our employer link service, and trying to make sure that we do have good relationships with employers, with chief nurses, so that we can have those conversations. They can ring up for advice, because sometimes it's not obvious, and you actually want to make sure that you're doing the right thing, and that that you're not going to get criticised subsequently for not making a referral when actually you should have done. So one of the things, as I say, we have developed is our employer link service, which is now under the leadership of Sam Foster and Sam Donoghue, and that, I think, is going from strength to strength in terms of making those connections, so people feel confident that they can come to us and get advice and have that chat through. I think what your chief nurse is doing, which is making sure that there is a senior assessment of the referrals that are being made, is really important, because that I think helps within organisations for that internal challenge to happen to others who may well need to be brought along a journey of understanding what is our job as a regulator, what is your job as an employer. But the other point to make is that the biggest group of referrals that we now get come from the public. And that I think is something which reflects back on what employers do as well, because in the vast majority of cases, it is not going to be a bereaved family or somebody who's had an awful maternity experience, or somebody who had a difficult experience of care. It's not necessarily going to be their first port of call to go, I'm going to the professional regulator. They would generally come to the local organisation, and they generally want to understand what happened, have an apology, be heard, be listened to. And when that doesn't happen, they will then think about, where else can I go? Where can I get what I might think as justice for the thing that has gone wrong? And then they will think about, well, who were the people involved? And because nurses and midwives and nursing associates are the biggest professional group, very often that is going to be the person that was in front of them, and that is going to be the referral that gets made. So again, I think there's something for us to feed back to organisations about the importance of responding to people who are raising concerns at a local level, and resolving that in as positive a way as you possibly can. And I do understand, I've been there myself, it is not easy sometimes to do that, but if that can happen, that may well mean that those individuals do not feel that they have to make a referral, which in very many cases will not go much further than screening, the first stage of our process, where we assess whether this is a case for us or not. But it will have put them under enormous stress, and it will have put your colleagues under enormous stress as well.
And Andrea, I recognise that. I mean, I see every formal complaint, they go out in my name. Obviously, I read them and agree with them and sign them off. And quite often, I see regularly, actually, the complaint is often, I want to know how I can get that nurse, that doctor, that dentist, that allied health professional struck off because they did blah, 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 blah. And you're right, it's very much around explaining, yeah, something went wrong, but it's not something that actually hits the threshold of, we're not going to refer them to the regulator because we think they've made an honest mistake, or we think they did this. And clearly it's in their ballpark if they want to do it after that. Interesting. That means that the regulator treads quite a fine line between that element of fitness to practice, absolute standards. No, this is a standard. We're not going one way or the other on that. whilst at the same time doing so much work to support organizations to do things well, to feel empowered. And I guess that's the connection, isn't it, about the difference you make in provider organizations, because you're there to support, but you're also there to regulate. And is that a tricky balance, I suppose, should be the question.
Yes, I think it is. I mean, and I think I think we have to be very mindful. Our duty is to protect the public, to ensure that the nurses, midwives, nursing associates on our register were the right people to go on in the first place and are the right people to stay there. And as registrar, that's actually a very personal responsibility, which, yeah, I'm sure you get asked those questions, don't you, Matthew? What keeps you awake at night? Well, that's definitely one of the things that keeps me awake at night. So that's fundamental. But I think that there has been something that's happened around professional regulation over the years, which is that partly because of what professional regulators themselves have done, partly because of the adversarial nature of the fitness to practice process, which is set out in law, and the precedents that we have of all of the different cases that have gone before us, sort of push people into that space. And also sometimes because people have weaponized professional regulators. I have seen people saying, you have to do this or else I'm going to refer you to your regulator. It's not going ever anything that we would strike people off for, but I know that it puts fear in people's hearts. And I genuinely think that we do not get safe, kind and effective care if you make 808,488 people scared of their regulator. So there has to be clarity about our role, clarity about our expectations, but also a compassionate understanding, if you like, of the circumstances in which the professionals on our register are required to deliver care. And sometimes when things go wrong, it is the context in which they were operating. It could have been anybody on that shift at that time, because there weren't enough people, or the right equipment wasn't there, or the right training hadn't been provided, or whatever. And I think that us all collectively understanding that is the difficult situation that very many professionals are operating in is really important.
Yeah, and clearly, if an organisation should guide your work to say, what are we at fault with that created the environment and the ingredients that person made that mistake?
Yeah, and
that's our job. Yeah.
Yes. Yeah. Yeah.
So a real interesting balance there, Andrea, in terms of the role, interesting balance in what you do as an organisation. The tentacles, maybe they're not tentacles, they're lines across into other organisations that work at a national level. You've had to make quite a lot of cultural change in the organisation, and it was about how the NMC operates. How have you started to do that with the team, and how have you led that change?
When I came into the organisation, and at the point that we were thinking about developing the new strategy, what we also did was think about the values that we wanted to have as an organisation. And we did a lot of work, both with colleagues, but also with professionals on the register and with our partners, to understand how people saw that culture at the time and what they wanted. And as a consequence of that, we developed a set of values which set out to be fair. So you want your regulator to be fair, making evidence-based decisions at all points. What's the evidence for the standard that we're setting? What's the evidence for the judgment that we're making in fitness to practice, whatever it may be? But also fair in terms of equality and equity, and making sure that we had that absolutely at the heart of what we were doing. We wanted to be kind, So treating people with dignity and respect, and that included colleagues within the organisation, but also the way that we worked with the public, with the professionals, with our partners. We wanted to be ambitious, so to be the best regulator that we could be, to be the best employer that we could be, recognising that we had work to do on that, and that to be able to do that, we needed to be a learning organisation. We needed to take the opportunity to look at ourselves and say, this went wrong, we can do something different as a consequence of that and improve. And last but not least, we wanted to be collaborative. And in being collaborative, we wanted to break down the silos within the organisation and get people working across the organisation in a better way. And we also wanted to reach out and work more collaboratively with others at a national level in particular. I would say to you, Matthew, that is a journey. The cultural change is not easy. And I think we've had some successes, and there are certainly people who tell me that there has been change over the last 5 years, and that we are a kinder organisation to each other, and people do feel that they are supported by their managers and that they're having a good experience. Partners and professionals, in particular through the pandemic years when we were all working at such a frenetic pace to try and do so many things, saw us as being a much more connected organisation than we previously had been. But we are nowhere near the finished article, and it is clear from both the results that we've got in our staff surveys that we engage with the Workforce Race Equality Standards survey as well, and so we get some painful messages coming out of that. Our pay gap analysis, we had some whistleblowing allegations which are under investigation at the moment, highlighted last year. It's not consistent across the board, and it's quite clear that some people continue to have a bad experience of the organisation. And we need to continually be reflective about that, listen to those voices, respond to those voices, be agile in changing the approach if that approach needs changing, strengthening the things that we need to strengthen, but being, I suppose, restless in wanting to make sure that we make the difference that we need to make. And I sadly am having to step down because of ill health. But this sorting out fitness to practice and the cultural things that we need to do internally are probably two of the biggest areas that I regret the most that I have not made as much progress as I would have liked to have done.
And as you say, culture change takes a long time to make, but then just as hard to sustain, in my experience, and just as much effort. So for people that are listening to this, just can you give them kind of some insight into, as a leader, how you've gone about that change? Because I think that's the bit we talk about what we change. You just talked about some of the things that you wanted to do, but how have you pivoted and how have you done that with a leadership team, just to kind of give people a glimpse into the NMC about making that change?
I think that there's a number of things. One is have the clarity of your purpose. That is absolutely essential, and be prepared to talk about that all the time and make the connection between what people do and the purpose of the organisation. So when I do the welcome session for all new starters, and I have 3 key messages for them at the end, and the first of those key messages is, it is all about the people. And it doesn't matter what role people have. And I love it when there's somebody from procurement in the group, because you could do procurement anywhere, but you're doing procurement for the Nursing and Midwifery Council. And that means that we've got the resources available for the teams that are actually setting those standards, maintaining the register, sorting out fitness to practice. And that means that the care that my dad is getting from his district nurse today is really great. And everybody has got that story, because every single UK citizen is touched by a nurse, a midwife, or a nursing associate at some point in their lives. So be really clear about that purpose, make that connection, galvanise people to think about that. The second thing, I think, is listen to the voices and respond to them. So it's not good enough just to listen. People need to know that when they are sharing their stories with you, you are going to do something about it. And sometimes that's hard. And sometimes it's hard to demonstrate that you've done something about it. And people will be impatient for the change that they want to see. And I think that we need to constantly be aware that that is something that you could, like you say, it's not just about change, it's about sustaining it. It's about doing it every single day and not thinking that it's been cracked, because it never is. Because the thing that I've certainly learned is that you can have people telling you that they're having a great experience at the same time that people are telling you that they're having an absolutely dreadful experience. Both things can be true in the same organisation, and you need to make sure that you're not just kind of feeling all nice and fluffy because you're hearing the good feedback. You need to hear the hard feedback, and you need to do something about that. And then the third thing I'd say is, just to be a bit personal about it, is you have to put you into it as well. I think there is something about leaders authentically owning this and authentically caring about this, even if we get it wrong. And goodness only knows how many mistakes I've made in this job, and would have continued to if I was staying. But if people can see that you are bringing yourself into it, that you do care about it, that you are listening, that you are sort of responding and talking to people, and not being standoffish, and not being the kind of chief executive on high who doesn't talk to anybody, that's not me. So I wouldn't be able to do a job like that. But I think there is something quite powerful in you being a vulnerable leader and having humility about what you don't know and what you need to learn from others, so that you can make the difference as well. Does that make sense?
Well, of course it does, and that's one of the great things about leadership. But as we bring this to a near conclusion, Andrea, that comes with a downside, doesn't it? Because that's personally quite draining. And you've already said, what keeps you awake at night? 848,000. I won't quote the figure because you know them and I don't. But knowing that you've done all the right things so every nurse can be and midwife can be fabulous in their jobs and provide great care. It's a heavy burden sometimes. So how do you balance that out as a leader? What sustains you to be able to have the balance?
Yeah, I'm probably a do as I say, not as I do kind of person on this one, Matthew. Because this job is an absolute privilege, and I love it, and I devote more hours than probably any sensible person should to it. So really wouldn't suggest that people follow my lead on that. But I guess what sustains me is believing in what I do. I could not do it if I don't believe in it. And I like I say, it is an absolute privilege to be the registrar and chief executive of this organisation, and to support what I think are some of the most amazing professionals in our health and social care system. So have that passion. Have that passion for your team in terms of recognising and understanding the work that they do, and appreciating and valuing it, and making sure that you are supporting them. Thinking about yourself a bit. So I've had a coach. I've had a coach for a long period of time. I genuinely do not think I could do my job without that opportunity to have a conversation with somebody on a regular basis, which is just, sometimes it's just decompressing. Sometimes it's talking through a problem. Sometimes it's just screaming at the wall. But actually having that opportunity for somebody whose sole purpose in life is to make you better at your job. And then last, but do have a bit of balance outside. So I love the theatre, I love cinema, I love music, I love hiking, and you all make sure that you do the things that you love as well, because that nourishes you and gives you some of that energy back, which you need for these jobs, because they're not easy and they are hard. They do take a lot out of you. Generally say, don't be a regulator if you want to be liked, because we are making decisions every minute of the day that somebody's not going to like. And we may well be making very good decisions, but other people will definitely have different opinions about it. So actually making sure that you recognise you do have to have a well of resilience and to be able to do it.
Andrea, it has been absolutely fascinating to listen to you, that whole approach of, you know, the stats, 1 in 100 people will be on the register in that's the UK, I think, was it? Yeah, which is phenomenal. And 800 and all the other 8s on the register, 848,000 on the register.
808.
That's the one. Your role in regulating quality assurance standards, code of conduct, that education support, the ever increasing international recruitments, 20% of people on the register, over 50% of people coming on, and then clearly those really important balance of fitness to practice, revalidation, and getting the levers right, I should say, about how you do your job and all the things that you've done. I mean, it's sad, Andrea, that you're stepping down from the NMC, because 5.5 years, I think you're kind of giving that flavour of isn't enough to do everything that you need to do. And I know I will be with everybody else in wishing you well as you go through your treatment, and hope your recovery is fabulous, because we clearly need you back in some type of role for your expertise. If you would, I think let's offer you the last chance. If you were in the role still, what would be your things that you would be looking forward to, not maybe just in the NMC, but professionally in health and social care? What would you identify as that would be really interesting to be involved in that?
I'll be selfish, and the thing that I am really, really going to miss in terms of having to step away from the NMC at the moment is the revision of our code of conduct, which will be due in 2025. Current one, which was established in 2015, has been excellent, has seen us through thick and thin, particularly with the pandemic. But the opportunity to engage with the professions and really think about what is the code of conduct, the behaviours, the standards that we want for nurses, midwives and nursing associates that will set the tone for the next 10 years in a very different environment. And that's the magical thing of it, isn't it? Is that it is going to be different. We've got different people coming into the service, and we've got different challenges that we've got to face. But at the core of it, we'll be saying, this is what you can expect from these professionals. Yeah, I'm going to really miss doing that.
Well, you've beautifully teed up the recruitment pack for your council and your successor, who clearly needs to listen to this, because, yeah, it will be a fabulous thing. All the things that you said you wanted to have done if you were still there, but also get that right, will all be better for it with those things improving. Andrea, thank you so much for your time and for your insights and for your wonderful leadership at NMC. And I wish you absolutely the best as you go in, as I'm sure to all the listeners, as you go into the next phase of both personal and professional things.
Thank you so much, Matthew. I've really enjoyed the conversation.